Good evening, everyone. I'm Freddie Bell, and welcome to another presentation brought to you by the Association of Black Economic Power. And this week, we're talking about the real cost of healthcare, more than dollars and cents. Want to let you know a few house cleaning items before we begin that if you have a question, you can place it in our chat. I'll be contacted if I don't see it myself, and our esteemed team will make sure that we try to bring as many questions forward from you tonight as this presentation unfolds. While healthcare costs are rising, Black and minority families are impacted beyond dollars and cents. Our life longevity depends on our capability of receiving healthcare. Some families today have to balance seeing a doctor or buying groceries, getting gas, and much more. This correlation between health and wealth is really clear. Countless studies show us that those who have more financial resources tend to have access to better health care. However, when we think about health care, many of us we must consider the cost, and all too often, the real cost may come down to life or death. The real cost of health care is the care of our health. We want to examine that tonight, and with us, we have an esteemed panel of experts. I'll begin with Mrs. Akmiri Sakara, who is the board of and the chair of Healthy Black Pregnancies, as well as the Chief Financial Development Officer of the Cultural Wellness Center. Also joining us tonight is Mrs. Anika Robbins. She's a 25-year business veteran and a community servant. She is also the founding president and CEO of the Anika Foundation. The Anika Foundation partnered with Ramsey County and is hosting the second annual Juneteenth celebration in St. Paul this Saturday. It's at Alliance Field in what I like to call Carter Country. And Dr. Juno Robbins is an award-winning chiropractor. He's an author and speaker and teacher of wellness and empowerment strategies that inspire. And he's also the chairperson of the Association for Black Economic Power. Good evening, everyone. We welcome our panel and we welcome all of you. And let's start right away with some questions to get us started. One question that I'd like to start with is one that is really just fundamental to our conversation this evening. Dr. Juno, we'll start with you. Could you define for us what is healthcare?
Absolutely. Thank you, Mr. Bell. And it's good to see you and everybody else on the Zoom today. I think we need to define the word health in healthcare. So much of the care, especially in Western society, is about sick care. And we talk about going to the hospitals or going to the doctors to help us when we're sick. But really, we need to focus on health and thriving, vibrant, physical, mental, emotional bodies. That's healthcare to me, focusing on the preventative aspect and the thriving that we can really do as human beings.
All right, a good start. Mary Sakara, what is healthcare? Dr. Juno said it could be called sick care. How do you define healthcare?
I define healthcare much in the same way. It's about caring for oneself and letting others be able to help you be able to do that if it is necessary.
All right, really succinct. As we continue with sick care or health care, as Dr. Juno says, what determines, in your opinion, and or influences our health, Dr. Juno?
A lot of things for sure. It could be our environment, but I am big on our personal responsibility, our education. So much of what we know is taught to us by society. Ultimately, it's 100% our responsibility to learn that the power that made the body has the ability to heal the body. It's the foods we put into our body, it's the movement, the motion of our bodies that allows our body to function at maximum capacity, optimum capacity, I would say.
We mentioned earlier about your background, so you're really astute in the idea of chiropractic, and that is, it seems as if you're saying that's a fundamental portion of healthcare. Is that right?
It is. One of the reasons I went into the chiropractic field is it's holistic healthcare. So no drugs, no surgery, believe in the body's own ability to heal itself. We just kind of help it along its way. And all the systems in the body are controlled by the nervous system. All the nerves in the body come from the top of the neck down to the bottom of the low back, and then they branch to the different areas, some to the physical, the muscles, but a lot to the internal, such as the digestive tract, the circulatory system, the immune system. If you keep your nervous system functioning properly at high capacity, optimum capacity, you just don't get sick as much. When you do get sick, your body has the ability to heal itself if we don't do too many things to prevent that.
Interesting. I'll go back just for a second here. Mrs. Anika Robbins, as I mentioned at the outset, a 25-year business veteran and community servant. She's a founding president and CEO of the Anika Foundation, has joined us. And again, the Anika Foundation partnered with Ramsey County recently and is hosting the second annual Juneteenth celebration in St. Paul this Saturday at Alliance Field. The question we put out there initially, Anika, is defining healthcare. In your opinion, what is healthcare? What's your definition of it?
Thank you so much, Freddie. It's good to be here. Yeah, healthcare, I'm sure my husband gave the more official definition of it. And there are very many understandings of what healthcare is. For some, it could mean insurance coverage. For others, it means a total well-being of the mind, body, and soul. And that's really the approach that I view it as. I heard my husband talking about the connectivity between the nervous system and other things. So when we look at healthcare, we need to really be thinking about it in terms of the health and vitality and the well-being of our minds, our bodies, and our spirits.
That's a nice backdrop. And Mary, I was just wondering, we were talking about what determines and influences our health. What are those determinants in your perspective?
Well, in the work of the Cultural Wellness Center, we believe isolation, loss of community, and loss of culture is what makes you sick. And so we really try to work with individuals that we do see and who come to our center to really talk about that and how that affects your health, and how culture, being able to be connected to your cultural heritage, can stop that isolation and really help you be able to really think about your own health care.
I'm going to ask you to go a little deeper with that. I'm just curious from that perspective, then, what does it really mean to take care of your health? Let's first start with the mental aspect of it that you touched on.
Well, the mental aspect, really looking at people's way that people think about isolation. When people are isolated, they tend to go really inward and not really think about their health and their health care. And so really wanting people to be supported, to be able to reach out to the community and the people that are around them that they feel safe with, to be able to support them in all their kind of health decisions. Because nobody should go to the doctor by themselves. Everybody should be accompanied by someone, so somebody else can hear what's being told about your health. And so you're able to process it with somebody afterward. And so that's how I really try to do my health care. I'm really trying to have a sister friend go with me, especially if I'm concerned if something is really going on.
The question on the floor is taking care of your health. And like Mary was talking about the mental aspect of it, Dr. Juno, I'm just curious, how would you look at, or what are the fundamentals of mental care? Or is mental care really health care?
Mental health care is absolutely healthcare, and it's paramount. Within our community, especially Black men, undiagnosed depression, for example, is a problem. And men feel like we can't talk to somebody about it. I definitely support the notion of having an advocate with you, or having a confidant with you, that you can share some of your feelings, your concerns. When you go to the doctor, what the doctor is saying to you, it can help advocate for you as you advocate for yourself. Ultimately, we do need to advocate for ourselves. And as Black people in the United States, especially in certain areas, often we're not listened to in those healthcare settings as deeply as we need to be. And you can't just allow yourself to be dismissed if you don't get the answers you should have or you are seeking, you need to continue asking those questions. But back to your original question, is mental care healthcare? 100% absolutely, and it's paramount.
I just have to ask you again, Dr. Juno, why aren't we listened to, and who is the we that we're talking about?
Sure, absolutely. Here as a Black doctor, I've been a practicing holistic healthcare provider for 27 years in North Minneapolis primarily. And I have seen that patients are more comfortable sharing with people who look like them. And I've heard stories of my patients that have gone elsewhere to predominantly white areas, predominantly affluent areas, and they feel like they're being dismissed or their cares, their concerns are not being listened to. Um, I think as a Black doctor, I have a tremendous compassion. I have a tremendous empathy for those who are in our community. We would always say North Side by choice, not necessity. And part of me being a Black doctor in North Minneapolis, it's especially young men. So between 20 and 30 years old that come in, they might come in for an injury. They might come in for whatever, but the conversations I have with them and have them see a higher version of themselves, they see a Black male doctor, they say, hey, I can do that. And we have talks of encouragement, which is just as important as the getting the physical self better. Again, back to the mental aspect.
I don't want to assume that you and Nika just sign on to what Dr. Juno is saying, but I'd like for you to talk to us a little bit from your perspective about the mental aspect of healthcare, or has everything been said on that particular point? I suspect not.
You know me well, Freddie, but the range of work that the Anika Foundation has been able to engage in, whether it's our work with the University of Minnesota or Minnesota Department of Health and our school systems. In fact, many of the current projects we're working on, the top thing when we're speaking with superintendents in our public schools, when we are talking with Black men and parents, is that mental health is a major problem in our community. We publish a health and wellness resource guide called the Quality Life Minnesota, and we interviewed representatives from Turning Point, and they talked about the different life shocks that can cause mental dis-ease. And so those life shocks can range from job loss, it can range from divorce. We know that right here in our community in Minneapolis and St. Paul with George Floyd and Dante Wright, Amir Locke, and the pandemic all happening at the same time, that our community, regardless of your income level, gender, your education level, your ability to be resilient, many people are facing difficulty managing and coping. And it's okay for us to normalize saying, hey, nothing in our range of lived experience has prepared us for this amount of life shocks that have happened so quickly in such a short amount of time. And of course, the research bears out that, those who have 7 or more life shocks more than likely live in poverty or lower income. And so we have those socioeconomic factors that contribute to that. We know that mental health is stigmatized in our communities. We're slowly coming out of it, thanks to practitioners like those at the Cultural Wellness Center, works that we're doing, trying to make sure that people are talking about it, seeking support. And it is also important, it matters to our community that support comes from people who, as my husband said, that look like us, that may or may not have that same shared lived experience. Racism is a factor, continues to be a factor, impacting even the most learned of individuals. The workplace continues to be an environment where people are facing, bullying, racism, gaslighting, or as some of the more technical terms, perceived slights, So it's very much present in our communities, and we need support, but we really need to start paying attention to our children, suicidal ideation. Yes, Ms. Harrison, I see the microaggressions. You know, that's increasing with our young Black men. They're losing their friends in school. I could go on, but I think you get the picture. It's something that we have to see as an emergency in our communities. There are long-ranging effects with COVID-19 that we're still learning about as well. So I think this is an important conversation to have. Thank you for this, Freddie.
It's really interesting, and thank you for that, Anika. We could do an entire presentation just on the mental
Yes.
aspect of healthcare. I want to pivot just a little bit and stay with you just for a second. So all three of you have eloquently talked about the mental aspect of healthcare, and actually it's just an introduction. Can we swing to the physical side of healthcare? What are you seeing? What does it mean to take care of your physical health, Anika?
We have we have to take care of ourselves, and we have to prioritize taking care of ourselves. The stress leads to inflammation in our bodies, and it causes our bodies to break down. You know, Black people are overrepresented with almost all of the top health disparities, heart disease, diabetes, cancers, and whatnot. And so exercising, getting enough sleep. Sleep is kind of a sleeper. Most people, you know, a lot of doctors are realizing that sleep is a risk factor. The lack of sleep is a risk factor. People are not getting enough sleep. There's such a thing as sleep hygiene. You know, is your environment conducive to a deep level of sleep? My husband's always like, turn that TV off, you know, so, you know, because so you can get into that deep REM state, the REM state, right? So sleep is important. Of course, water intake. We saw during the pandemic and continue to see the rise in opioid addiction, substance use. People are finding ways to numb and to numb. And so working out, having strong connections, you know, like the sister mentioned, you know, having a buddy to go with you for healthcare. Black men are often labeled hard to reach in the medical industry, you know, least likely to be connected to a physician. So we just have to realize that, especially in the age group ranging from 45 to 65, we are all high risk. You know, I'm 50 now, so I'm a risk factor. But the point is that we have to exercise, we have to watch our diet, limit alcohol intake. If you are a smoker, stop smoking, like not limit, just stop altogether. All of those things matter. And, you know, there are a lot of people that are passing away much earlier than they should. And so these are some things that are cost effective. Sometimes it's free to just, you know, walk around the lake, you know, grab your neighbor, go around the neighborhood, those kinds of things. So the physical health is important, but, you know, and it's all a cycle with mental health, physical health, and then emotional health as well.
We're talking about the real cost of healthcare, more than dollars and cents. And Mary, you work with Black women and their pregnancies and so forth. Talk to me about the physical aspect and the real cost of physical health.
Oh my goodness. I work with families just around health, because when someone is pregnant, a family is pregnant. Everybody who has a baby, then who participates in the birth of a child, is birthing something. And so talking to them just about what kind of health, even pre-pregnancy, what had happened, how were they taking care of themselves, all of that affects the coming return of the ancestor. And it also, even talking with people just about mental stuff, just even how people know how they were born, because cycles repeat themselves. And so however you were born, the same kind of cycle will happen with your own children. And so whether or not you want to be able to, if you want to make some changes about that, And so people have to be really, really ready to be able to talk about that conversation, both the partner and the birthing person.
So, Dr. Juno, can we really separate mental health from physical health, considering all the stresses we've gone through with COVID and related health issues, the physical health issues? Is it one, or do we need to chop it up and treat these issues separately? Can you separate them?
You know, Freddie, it is really one, right? So emotional stresses, especially long-standing emotional stresses, often manifest in things like muscle tension, for example. That muscle tension can trigger things like headaches, can trigger things like back pain, right? I can't stress the importance of exercise enough. The body is meant to move.
Mm.
Oftentimes with the physical exercise, one thing we can do is kind of multitask it, right? So walking is probably the best physical exercise anybody can have. Um, One thing I do, as my wife knows, I'm always doing paperwork, always doing paperwork. In the basement of the house, I have a desk treadmill where I can get on there and just walk, 1.5, 2 miles an hour. And I'll sit down there for an hour or two and just do my paperwork, get that accomplished, return phone calls, return emails. And I've walked a good couple of miles, and that takes care of some of the whole stress. When you move, when you exercise, it's good for stress relief, right?
Hmm.
Um, Another aspect of the physical health that we need to talk about is the inflammation, the microinflammation that gets into our bodies. And some of that is due to the foods that we eat. We need to try to avoid a lot of the processed foods, the fast foods, the fried foods. There's obviously the cholesterol issue, but there's also an inflammation issue. You get that inflammation into your bloodstream, it can cause pain, but it can also lead to things like stroke, can lead to things like increased cholesterol in our bodies. Um, a good rule of thumb, if it can sit on the shelf or it can sit in the cabinet for a month and you eat it, it's probably not good for you. More fruits and vegetables, please.
So, in that, I'll stay with you just for a second, Doctor. So, what do you consider to be the most important thing, or two things that we can do for a healthy life? I know we're talking about the stress, we talk about the physicality of it. How do we construct that mental uh, health, the physical, mental, healthy path to get on? What can we do once we leave this session tonight that we can do two things today that can get us on the right path?
Sure. Number one is to know that we take 100% responsibility for our health and let those people around us, whether it's, our families definitely want the best for us, but even our employers, right? So I have employees, they get mental health days, they get days to go to the doctor. I've seen in the chat that a lot of Black men and women fear taking the time needed from work in order to go see the doctor, fear losing their jobs. And the communication to the employer is, hey, if I'm healthy, if I am well, I am going to function better at my job. I'm going to do better quality at my job. I'm probably not going to have a work comp type injury. It's in your interest to let me get the help I need so I can go ahead and do my job better, type of thing. Trust me, bosses, employers will listen to that argument.
All right. Anika, how do you respond to that question? What do we need to do? A couple of things we can do today.
Drink water, drink some more water. I would also say pay attention to your breathing. A lot of times, I'm definitely one to travel, right? To decompress and whatnot. I love spending time at the beach, but sometimes we don't have the opportunity to run away, right? So we have to start to learn different practices that we can adapt in the moment, right? So whether it's taking the time out, sitting still, yoga practices, meditation, deep breathing, making it a point to get solid sleep. But I want to take it a step back and say, because, people know these things, they've heard it before, but you almost have to do the preparation to do those things. So getting a good night's sleep means, time management is not talked about enough, right? So how we manage our time and, whatever our responsibilities are, and carving out time to take care of ourselves, carving out time to get all of our work done so we can go to bed early, wake up early. Some people have started doing food prep, right? Because sometimes in this fast-paced life that we that we live, everything's go, 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 right? And so, as my husband said, eating more natural foods in their natural state, but planning for the type of life and then being resigned in your mind
Mhm.
to take those measures really is what will help. And then don't be hard on yourself if you fail the first time, right? You woke up
Yeah.
10 minutes late, you know. So be graceful and gentle with yourself, and then keep going though, keep trying. Yes.
We're hearing remedies. Thank you, Anika. We're hearing remedies tonight as we talk about the real cost of healthcare. And Mary, and I see it in the chat here too, that I've heard over the years that it's cost too much to live healthy. So I'm just going to do what I need to do to get through. But is there a way that we can manage our health? We're in the chat. We're seeing a question about people who are planning for pregnancy. Does it have to be expensive, even if you don't have health care, to live a healthy life?
No, it doesn't have to be expensive at all. It's a mindset more than anything.
Healthcare is a
Um,
mindset.
it's a mindset. It's a
Hmm.
mindset. It's about thinking healthy thoughts, and doing healthy things, and making sure that you're not isolated, that you are able to talk with others and have a support system around you to be able to bounce things off of. I see the question about what people can do to prepare their body for pregnancy. That's a mindset.
Hmm.
You call to you who you want to come to you, and it's about really taking care of your own health, making sure that you're healthy, and that you're ready. You're ready for it, because most of the time pregnancy is not planned. 95% of the time, it's not a planned thing. It just oops, it's something that happened, and so really looking at your health care for yourself and for your partner too. And what have they been doing health wise, and where is their mindset about being ready for someone to come into their life, someone new.
Mary, thank you so much. And Dr. Juno, healthcare is a mindset. I've not heard that concept before when we were talking about, and I've talked to a lot of people over time about healthcare. What does that really mean from your perspective?
Hmm.
Or do you agree with Dr. Mary?
I agree 100%. I think Anika had used a phrase earlier. She said disease, but broke it down into dis-ease. So a dis-ease, non-ease on the body. That goes back to mindset, right? That goes back to emotional well-being. And so many of the disease processes that we have in our bodies is due to a dis-ease of our systems. So I'm not sure if I answered that question. I do want to circle back real quick to the whole diet thing.
Sure.
Is it expensive? Does it have to be too expensive to be healthy?
Mhm.
Number one, in terms of diet, we eat too much.
I'm
Period.
taking that personally, sir.
I'm looking right at you, brother. But here in American society, you go, everything is supersized, right? You go to other countries, you travel, and sizes seem much, much smaller. I've actually taken to eating off of a salad plate oftentimes versus a big dinner plate, just because the amount of food on there, I'm full when I get done. When you eat, you should be just not hungry. You shouldn't be full. If you're full, if you feel stuffed, if you feel like you just need to lay around, you ate too much. And your body can only use so much energy from that food at a time. That which is not used gets converted to what? Fat. It gets converted to excess sugar. Gets I see somebody put in the chat, I like food. The flavors of food, when you grocery shop, for example, it's no accident that the most easily accessed foods are the junk foods, the processed foods. Very easily, when you walk in, as you're going at the cash register, they want you to pick those things up. They make it easy to order. There
Mhm.
is a definite correlation between the food industry and the pharmaceutical industry and big healthcare. Not getting into any conspiracy theories here, but we definitely need to take care of our diets, eat less, eat better, move the body, and that's good health.
So does that mean that if we do those types of things that we wouldn't have to worry as much about time away from work or child care losses, loss of pay if we took those kinds of steps, Doctor?
I think they would definitely help. When we talk about the real cost of healthcare, people taking time away from work, that affects the overall household income. For people that are deconditioned and have workplace injuries, they're not able to go back to work, affects the household income, also causes the employer a lot of money. I have patients that have lost their jobs because they were deconditioned. They had an accident, no fault of the employer, but if they would have been in better shape or, even mentally utilizing the proper lifting type techniques, they would not have had that injury in the first place. And we can't vilify people for not doing what they don't know, but when we know better, we do need to do better. And part of doing better is being curious about how can I live a healthier, more quality life.
Like Mary, Dr. Juno just set us up for the next question. He was talking about things are set up for us to make the unhealthy choices. The processed foods are right there. They're one of the first things you see when you go into a grocery store, maybe a fast food place. So why do you think is that part of the reasons why we make unhealthy choices? And do we really understand healthy versus unhealthy in our society today? I mean, really, it's the year 2023.
It doesn't matter if it's 30-30. I don't think we do. I don't think we understand. I'm sitting here thinking about even just my own process and how I made a decision that I'm going back to the Y. I bought a Y membership and I said, this is what I'm gonna do this year.
Mm-hmm.
And people you have to make that decision and not beat yourself up about it and cut out some of the things that you were doing that you kept saying, well, I just can't afford that membership. So, so maybe I won't buy that pair of glasses that I saw on online, if maybe I won't buy that piece of jewelry. So it's like you have to change your mindset just about what's important. And it can be difficult, but you have to keep talking to yourself, getting a buddy, having somebody that you can talk to just about that work, and that you need to move. It doesn't matter how long you move, but you need to move. You at least have to start the process. And so a lot of people aren't in the mindset to be able to do that. Not yet. I know that you go into the store and you see all those really special treats, and you say, well, I could just have one. And next time I could just have one, and it can't be like that. And so there's different things. There's a farmer's market that's around you can go to. You can even take up a new hobby, just even trying to grow food yourself, which will help because even the food now is not grown the way that it used to be. And so people don't let the soil rest. People just keep building more plants, and not even to talk about just the gentrification just of food too, just what's happening with it. So
I see.
we have a lot that is not in our favor that keeps us the way we are, because that's the way that healthcare keeps growing and growing, like keeping us overweight and high blood pressure. And I saw somebody talking about why our mortality rate was the way it is. It's about racism. People eat to avoid racism. I think because it's coming. It's about racism. I can't put into words why I feel like that, but I do. So
Well, let's
I
explore
can
that
hear
a
from
little
other
bit.
people just about what do they think, why our mortality rate is the way it is.
So, Anika, in your work, do you see that is this hereditary? Is it a racial thing? Is it a cultural thing for people of color? Just hereditary for the heredity to dictate that we are just unhealthy beings?
Not at all. I really quickly want to say, I like food too. We all like food. But the recommendation is to eat those smaller portions, but several times throughout the day. So this isn't about depriving yourself. So I just wanted to point that out. But hereditary. There are some markers, right, for disease, that are hereditary. So breast cancer, But the reality is that anybody can get cancer at any point throughout their lives. We are all organic beings. But what is hereditary is our food preparation practices, and then whether or not we just say, oh, I got the sugar, right? Which is how we talk about diabetes. And so, but we can change our trajectory through holding ourselves accountable and exploring different ways of cooking food, right? So sometimes if you only learned or only grew up eating a certain kind of food and you just continue on with that, I know a lot of times people just don't know how to put different combinations of vegetables together, different combinations of fruit. Now, as someone who grew up in Africa, a lot of our cooking practices are vegetarian, believe it or not. The fried plantains, the egusi stew, which is made with collard greens and crushed melon seeds and fresh ground peppers and tomatoes. Our food is flavorful, okay? The jollof rice and the fresh fish. So everything in our ancestral way of living, I mean, we know how, we understand agriculture. When Dr. Amir mentioned about the soil, we understand those things. We just have become highly industrialized and far removed and assimilating and so forth. But racism is real and it has caused different impact. A lot of people, the way that people use substances to numb pain, food is used the same way, sex is used the same way. And so it's really about having the relationship with ourselves, which you often don't hear about that either. Like, what is the relationship you're going to have with yourself, and the messages, the deprogramming and programming with, hey, I'm going to try these various combinations of food. A lot of times when our people hear healthy eating, I believe the assumption is that it's not going to taste good, but it's far from the truth, right? We think everything's got to be deep fried in order, and that is, now, I am one for some fried chicken, so I'll just put that there, and red beans and rice, but baked chicken is delicious as well, right? Steamed, stir fries. So we just need to, again, branch out, try different things, but the cost of our choices with food choices, lack of exercise, we see it in our communities, whether it's in the family in terms of income, but we also see it in the workplace. And so we're starting to see different employers, public entities, make some investments in the health and well-being of their employees, because people are, they are at disease, and they realize that they need to make an investment. It costs more. Health disparities put more of a burden on our economy. Let me know when you're ready to go in that.
All right. So I'm hearing the theme tonight is I like food. I think everybody can raise their hand on that one. But I see an interesting question in the chat. It says buying fresh fruit and veggies is hard when you're on a budget. Buying food that is processed is cheaper. Dr. Juno, do you buy into that? What would you say how would you respond to that question or that statement? Because I've seen some people do some amazing things with fruit and vegetables, and it's not nearly as expensive as it could be with the other choices that we can make. How would you respond, Dr. Juno?
Sure. First, I would respond by acknowledging the statement as it's legitimate. That's a legitimate statement. I would say that there are resources that do offer fresh fruits and vegetables. And for those who have difficulty getting fresh fruits and vegetables, I would seek out those resources. I don't know off the top of my head what they are, but I'm sure they can be found online. Where there's a will, there's a way. And I think if somebody really wants to eat well and have fruits, have vegetables, they will find a way to get those versus the processed foods.
So I'm curious, thank you for that. Mary, what do you tell the people that you talk to? You mentioned families. How do you bridge that gap with the cost of eating healthy versus the quick processed choices that we sometimes make or oftentimes make?
Well, just talking to people just about what other sources are out there where they can get help with their food dollars if that's an issue. Depending on how old their children are, being able to refer to WIC, then and talk about going to some of the food shelves that are in the community that provide healthy food to the community.
Hmm.
And then also referring them to programs that actually teach people um, how to prepare the food that you do get if you happen to be on assistance. Different ways that you can prepare some of that stuff that you do get, like at the food shelf, that people might not know about. And so there are programs. I know there's one through the U of M that actually come out to the community and provide cooking classes. And so referring people to that. I was looking on my phone trying to find. We have a workbook that really talks about food is medicine. We have a thing that we say food is medicine or medicine will be your food. And so having people really be able to think about that when you do talk about people um, making choices, better choices, make good choices.
I like that. Dr. Juno, talk about nutrition education and the benefits of nutrition education as it relates to healthcare, the real cost of healthcare.
Sure. So see, we talk about some of the conditions that are more prevalent or seem more prevalent in our community, such as the diabetes, such as obesity, cardiovascular disease, for Black men, prostate cancer. And I think it was Anika talked about the genes or gene expression. There's certain things that you can be prone to. If I could touch for a second, just because we're prone to something or you have a gene to it, it doesn't mean that gene needs to be expressed.
Mm.
So picture it like a door with a lock. That lock is there. You don't necessarily need to put the key in and turn the lock. So I could have a predisposition to diabetes, for example, but I also know if I exercise regularly, if my diet is good, my nutrition is strong, that key doesn't need to turn the lock. That gene does not need to express for me to now get diabetes type 2. There's a
Mhm.
lot of different conditions like that. My father, he had prostate cancer. He did well with it for years and years before he passed. But one thing he did for me, which was an absolute act of love, he gave me a book on how to prevent preventative aspects of prostate cancer. He said, you and your brother, he's 2 years older than me. He said, you guys read this book, you follow some of these dietary recommendations, and hopefully you won't have this thing expressed in you as it expressed in me. So those are some of the values of nutrition. There are different things we can eat that decrease the inflammation in our bodies. There's different things we can eat that can just make us healthier overall.
Thank you for that. Anika, you mentioned in the chat about being expensive to go to the hospital, but what do you think about the nutrition aspect that Dr. Juno was just talking about? Are you aware of any nutrition classes? I think it was Akmiri who talked about the why holding nutrition classes. What can you suggest to us?
I support that. The University of Minnesota Extension program has several programs. SNAP, there are several programs, and we're also seeing in the wake of COVID, that there are several food distribution sites around the state. It has just really flourished. We're doing a food distribution with Second Harvest Heartland and Mount Olivet Lab School in St. Paul, and giving free fresh produce to over 500 families. But there are several events and several pop-ups and activations around our state. I believe it's called Twin Cities Free Food Resource. I'd be happy to share that with you offline. But so yes, fruits and vegetables sadly are expensive, but it is more expensive to go to the hospital from not making those choices, and being consistent in it. No one expects you not to have a donut on occasion or a chicken wing, but it's all about consistently choosing the healthier options versus not.
You're a businesswoman, Anika. I want to stay with you just for a second. So, how is there a way, or is there a strategy that you can think of? And I don't mean to put you on the spot with this, but where we can perhaps even collectively establish a Black-owned grocery store. I know there is a store near the Spokesman newspaper headquarters, or maybe
Sure.
a chain across the United States where we can meet our community needs. I see that there are food deserts with pharmacies going away. Uh, Cup foods pulling out of neighborhoods, and people just being strapped with finding places to eat. What about a cooperative in our communities? What would you
Thank
suggest?
Thank you for that. I am not directly involved, but I do know that there are efforts like Seward Co-op. They've been doing great work, and on the south side and southeast side, North Market is definitely there, over on 44th and Humboldt. But yes, North Minneapolis has endured a blow with the loss of Aldi's over on Lowry and Penn, the Walgreens. So there are efforts, I know Nexus Community Partners, they really are keeping that cooperative model alive. There are a lot of people who are, looking into those routes. And cooperations are, cooperatives, excuse me, are not new to us either. We had those, at the turn of the last century. We've always been a very cooperative people. But I know that there are some efforts through the Food Justice Network. There's folks like Appetite for Change, but it's really all hands on deck, and for our public entities to be recognizing those deserts and those gaps and working with us to fill those gaps. But those companies are pulling out for various reasons. There are social economic concerns, and so how do we balance that? How do we make sure that members of the community get their other needs met? And where we have communities that are conducive and support those businesses when they're in our communities. So it's a part of a broader conversation, right? You talk about the social determinants of health. It's really hard to have, one conversation about this without looking at all of the other extenuating circumstances.
Like Mary, I brought up the idea of a food cooperative. Is that a decent pathway to stem the tide of some of the cost that of being having a healthy life and living a nutritious life?
It's a good start. It's a good start, but we do have to address, I think, all the other kind of things that affect having that healthy food even be. And so, because we do have many food deserts, which lead to maternal toxic zones for our babies too. And so, cooperative would be good, but it's about you have to have buy-in from the community also to be able to make it work and to keep it open and happening.
Makes a lot of sense. And Dr. Juno, I want to go back to you just for a second. You're a chiropractor, and do you think that if we had more doctors or physicians of color, that it could help us in this space with when we talk about healthcare?
I do believe it could. I don't know the exact numbers in the medical as far as MDs and Black doctors compared to population. I know 3 or 4 years ago, there was approximately 60,000 chiropractors in the United States, of which approximately 1% were African American.
Wow.
So quite a disparity there. But the Black doctors I know, I used to be the board chair for the American Black Chiropractic Association, which is a national organization. And the majority of Black doctors there work in Black communities, not exclusively. And that was actually an interesting point. So we have a lot of patients of all different races, but predominantly African American. And it just seems that, people relate well to people who they can relate to the background. They just share. So yes, to answer your question, I do think it would help get this information out. I think it would help raise the overall quality of healthcare in our community to have more practitioners of color.
So do you know, and this is, I've never even thought about this question, but is there a Black-owned health insurance company that you're aware of, sir?
That I have never heard of, no.
Either of our panelists, have you heard of that in our even in the United States? Let's broaden it out just a bit.
I haven't heard of anything. I wanted to just talk a little bit too, just about what some of the growth has happened just within our community around about midwives, around
Mhm.
either certified nurse midwives and then home birth midwives. For many years, we had enough Black midwives you could just count on your hand. And now people, because of the crisis that we're having in maternal morbidity and infant mortality, that has grown now within the Twin Cities and, and just the state. We're up to 15, 20 midwives. That's certified nurse midwives and home birth. And so that's something to be proud of, but now we have to get our families in to see them. People think that midwifery care is subservient care, and we need to just educate people that that's not the case whatsoever, and that it's even better than OB care. And so, just kind of wanted to mention that that's my realm of reality.
All right.
Mhm.
Before we step away, folks, I want to mention that we do have a Black History Matters moment coming up. And I'll stay with you just for a second, if you don't mind. What should we look for? You do a lot of work with women and families. What should we look for in a healthcare provider? And I'll ask that of the other two panelists as well. What should we be looking for in a healthcare provider?
Someone that listens to you, someone that answers your questions, someone that doesn't pay attention to that clock that tells them, I only have 10 or 15 minutes with you, somebody that will sit with you.
All right. Anika, what should we be looking for in I'm going to say a great healthcare provider?
Yes, I think whew. So first of all, yes, there was an
Is it
article.
Dr. Juno?
Oh, well, he is. I will say that, and just a quick, yeah, my husband, his patients love him. They love his care and concern, his manner. He takes the time to listen to people. We've come so far away from the kind of country doctor, and he's kind of one of the last remaining ones that really spends that time. But as Dr. Mary said, listening, finding someone that listens to you, that understands, and then can refer you on. There's a study that shows that, yes, people of color often do better in cities that have more doctors of color. That is also true with our children and teachers of color. And as a matter of fact, all children do well with teachers of color. So this everything, all the stats bear out to that fact. But ask the questions, and someone who doesn't make you feel ignorant for not knowing, and then for them to make those referrals if they don't know. And that person, I will say, may or may not be another Black person. It's really about your ability to connect with someone who's really keyed into what's wrong with you, what's going on, and then can make the appropriate recommendations.
So the outline that we're talking about, Dr. Juno, is you, but what should we be looking for in a great healthcare provider?
I'll definitely buy Anika dinner after the show. No, both our panelists gave excellent points. So somebody who's going to listen to the questions, somebody who doesn't make you feel rushed, somebody who you have a rapport with. Certain people, certain personalities just don't vibe, plain and simple. And that's true in a doctor-patient relationship as well. The referrals on is so important, and that follow-up. I often tell my patients when they come see me for the first time, I say, I'm like the quarterback of your care. If you need to get to a neurologist, for example, I will get you there. If you need to get to an orthopedist, I will get you there. If you need to get to another practitioner, I will get you there. I'll kind of coordinate the team and call the play, and just make sure communication is super important, that doctor takes the time to communicate.
All right. I want to thank our panelists right now, Akiri Sakira, Akmiri Sakira, Nika Robbins, and Dr. Juno Robbins. Thank you all for being with us this evening. And I want to pivot right now. It's going to be a hard right turn, but this is so good. We want to share with you right now our Black History Matters moment. This is an initiative. It is a wonderful way for us to share stories of our unsung heroes. These moments are impactful. They're just well done, well produced. And it's important for us to not only remember, but to embrace who we are and never forget who we are. So with that said, sit back, relax, and enjoy this month's Black History Moment.
The Association for Black Economic Power is pleased to bring you this Black History Matters moment. Knowing our past can be a vital link to the success of generations to come.
In 1837, Dr. James McCune Smith became the first Black American to earn a medical degree in the United States. Referred to as the foremost Black intellectual in the 19th century in the U.S., he was fluent in many languages, including English, French, German, Greek, Hebrew, Italian, Latin, and Spanish. Additionally, Dr. Smith authored more than 100 articles in ethnology, geography, and medicine. In 1839, Dr. Smith opened a medical practice, a pharmacy, and a night school to teach geography, literacy skills, and math to people of all races. And while it's become a hot topic today, Dr. Smith was an early pioneer in the relationship between socioeconomic disadvantage and health outcomes. Nearly 175 years later, during the COVID-19 pandemic, public health researchers are echoing Dr. Smith in proposing that higher mortality rates among racial and ethnic minority populations should be analyzed by modeling interactions of race, place, and socioeconomic status without assuming that higher mortality rates result from inherent biological differences. Dr. Smith was born a slave on April 18, 1813, to Lavinia Smith, an enslaved Black woman from South Carolina, and Samuel Smith, a white merchant slave owner.
If you would like to learn more about our Black History Matters moments, please visit our website at www.abepmpls.org. We're looking forward to partnering with you.
Wonderful. And now I'd like to bring on the person who stirs a drink, Deborah Hurston, with some closing remarks and housekeeping, and to tell us what's coming up next month.
Well, first, I want to thank our panel. You were absolutely fabulous and packed with wonderful information. And I, like Ladina, love food. But this conversation is making me rethink my food choices, and thank you for that. I also want to thank you, Freddie, for coordinating this entire discussion. You do a masterful job, and we could not do this without you. And I would be remiss if I did not thank the staff, Ladina, Aida, Nasir, who's not here, and Karen, who's a little shy. She's behind the camera there. Without the staff, none of this, the panel, the program, the Black History Moment would not be possible. And I would like to encourage everyone, the Association for Black Economic Power, our primary objective right now is focusing on the credit union, getting the credit union going, in addition to doing wonderful programs like this. If you go to our website, you will see a link to a campaign. We're encouraging everyone to support that campaign for RISE. We are just steps away from getting it charted, but now the ball is in the public's court. We need you to go online and pass that link on to everyone that you know so that they can contribute to this last stage of getting this credit union chartered. And lastly, and I know we're just about out of time, I would be remiss if I did not thank our sponsor, Old National Bank. They love this program, and they particularly love the Black History Matters moment. So with that, I want to thank you all for doing this. And now that we have your number, we'll probably be back and have you sit again. Thank you.
Thank you so much, Deborah, and thank you to everyone. Thank you for listening. Thank you for your questions, and thank you for being here tonight. And for everyone who's been a part of this one, I'm Freddie Bell, and I invite you to join me on the radio, and I'll see you then. Have a great evening, and I love food too. Good night, everybody.